Hello, everyone, and welcome back to Co-Produced. I'm Adia.
And I'm Lauren, and today we will be having a guest with lived experience.
So our guest that's coming in today is a young adult within eating disorder services. She previously had a diagnosis of anorexia. She has since been diagnosed with bulimia, and she's currently on track for an ADHD diagnosis. In terms of her treatment history, she's previously done CBT, she's currently doing it again, and she's also at the day services.
Day services is essentially a middle ground between inpatients, where patients are in all the time and are sort of monitored 24/7, and then outpatients, where patients come in maybe once or twice a week just for a therapy session. So for day services, they come in 9 to maybe 3-ish, although it varies between services, Monday to Friday, where they eat all of their meals and snacks for the day and receive therapy.
Our guest today is going to kind of touch on some of these, so it's just important that you're aware of what that is in advance.
Hello, so today we have a guest. Would you like to introduce yourself?
I have lived experience with bulimia and anorexia. I was diagnosed with both, and I'm on my pathway of being diagnosed with ADHD at the moment, and I'm currently in day services.
Do you want to tell us a little bit about your treatment?
I'm having a really good experience with treatment at the moment. It's been a bit more successful, I would say, than my previous treatments because of the routine and the structure of it all. I used to find it really hard because I think you would tell me stuff to do and tell me ways to manage my eating disorder, but I always found that really hard because I need constant motivation, otherwise I will either forget or lose motivation across the week, because if I was seeing, especially in outpatients, on a week-to-week basis. So I found, especially because I'm on a gap year currently, the structure really helped, because if I didn't have that structure, I think I would be going down a rabbit hole in a sense. But yeah, I think what really helped me at the time is my old therapist. She was really persistent with trying to encourage me to get treated for ADHD because she noticed so many signs, and she made me aware of a lot of the symptoms that can fuel the eating disorder. And because she was aware of that, her treatment was very particular to my experiences, and that sort of I don't know, how she tailored it to my experiences. I think that really helped in the moment.
What kind of, traits were coming up? What did she kind of recognize?
She did a little list with me, and it's just very long. I found it difficult initially trying to get diagnosed because there's a long waiting list. So I've had to go through right to choose and all of that pathway.
Just for our listeners, right to choose is essentially where, because NHS waiting times at the moment for ADHD and autism diagnoses are so long, that private services are offering to do diagnoses on behalf of the NHS. So right to choose allows you to choose from one of those services, and you know that the NHS will still recognise that diagnosis, and your prescription from that service can be used within the NHS. So it's essentially just a way of accessing a diagnosis slightly quicker, given the complete overwhelm of the system at the moment.
But a lot of them have eating disorder restrictions because the medication is a suppressant for appetite. So that's been difficult. But anyway, back to the traits. So I'm so bad with punctuality. I'm so awful. I really, really find it hard to be on time. But I'm also perfectionist, but I find that I can't be perfectionist because I lack motivation and energy all the time. So I find I want everything to be clean. I want to be organised. I thrive off organisation, but realistically, I set myself too high goals in that sense. So then it makes me procrastinate them. Overall, I struggle with procrastination so much. With school, that's why I think I found it really hard. Though I achieved the grades that I was on track for, I probably could have achieved higher, but with the circumstances I had in the situation, I achieved high for what people expected of me. But it just meant I had to work 10 times harder. Another trait that I have, complete lack of sleep, because I procrastinate my bedtime I hate it because it's just like I have to get a whole list of tasks done before I get into bed, which means it's like before I will just sit in my bed with the lights on until I do my winding down bedtime routine, which means I'm going to sleep so late, and then that means I have even less energy, and it's like the cycle. I think one of the ones that links in most of my eating disorder is the boredom and how I'm unable to sit with boredom a lot of the time, and I think I find it very uncomfortable. And I find that with like just simple daily tasks, if I find it boring or like not, it doesn't give me any sense of like achievement, then I find it so hard to get up and do it. Like things like on a bad day it can be just like getting up and brushing my teeth. That's such a task for me, and I find that so difficult because it just makes energy like use. I find it so my energy is just always really low because of the amount it takes me to do little things. I think also another one that ties in with eating disorders is the impulses. I'm very impulsive. I've got a very addictive personality. I tend to get addicted to a lot of things if it gives me that dopamine hit. And I think understanding that when my therapist started telling me about how ADHD can be linked into my eating problems, the awareness made me really, it was just helpful understanding, I guess.
And how do you think your ADHD traits have impacted your eating disorder treatment?
I mean, I think if I'm not in a flow, like getting into the flow of this service specifically was really hard. I tended to miss a lot of days because I either had a bad morning or I just really did not have the energy to come in. And then lateness is also something I really struggle with. And then I get annoyed at myself for being late, and then that throws me off track. And then because I beat myself up about it, it makes me procrastinate it more. So it's just sort of like a big cycle, but I've dealt with it a bit more now. It helps that my parents are so supportive of me.
How has it caused problems potentially with your recovery?
Overall, like attendance is a big issue. If I'm not attending, I can't cooperate with the service. But I've found that like forcing myself to do things that my brain is just not cooperating with has really helped, because it's sort of like teaching me that in the end it is helpful to just go, because avoiding, which was something that I did all the time, was what was like not helpful at all. So like, yeah, just like unwinding that thought process in my brain has been helpful, although it's really hard. It's like even my CBT sessions weekly, I hate the idea of them, I hate them. But then when I go and I'm just like, that was so helpful, like what was I even thinking about? But I think the main thing that gets me is that I always tend to do like a 1 step forward, 2 steps back. So like I'll be in such a good flow and I'll have so much motivation, and then the next week I will completely like go into autopilot and then unwind all my progress and have no motivation whatsoever to complete the goals that I've set for the week or do the things that my therapist has told me to do. When that, I know it, if I like give in, then it just means that it's so hard to get back on track. And I feel like that's what I've been sort of experiencing at the moment.
And how do you think sort of being aware of maybe having ADHD or like receiving a diagnosis has sort of helped you, or is it helpful?
I think it is helpful in a way. Initially I thought it'd be unhelpful because I think I'd focus on it too much. But it has been helpful, especially because, I don't know, like my lack of sleep. I think being aware that that's probably revenge bedtime procrastination, which is like where you procrastinate your bedtime. Just like learning about that, and just like learning that a lot of the traits I have are associated with ADHD, and just I think the awareness has made me realise there are ways to cope with it, and there are ways that I know myself now well enough in terms of like what I work well with because I've got ADHD, or I possibly have ADHD. It's just been helpful to like know that if I need to do a task, breaking it down, otherwise it will get avoided, and just like little minute details that I'll alter in my daily life and daily routines that have helped me And I'm glad my therapist, like prior to this treatment, was more observant of that, because I feel like if she hadn't told me, it would have been a very hard journey, especially when I'm actively trying to recover now.
And for any clinicians that might be listening today, what is important for them to know?
I had a little bit of a deep dive on this, and I think I came to the conclusion that just general acknowledgement that when I may seem lazy, I am trying so hard, because underneath all the messiness, it's really like it takes a lot for like little things that may seem easy to like a neurotypical person can be, even if it's like so simple, I can find it really hard. So I just that acknowledgement and that like just making me aware that they don't think I'm like being lazy and they understand in a way. I think that's really helped, because if I get punished or if I get like people get annoyed at me about it, it probably will fuel it more, and that's just even more frustrating.
And what about outside of sessions when clinicians give homework or tasks to focus on?
When setting me tasks, I guess just giving the patient constant reminders, because, or like making it really accessible, or like telling them to do things that will be like, or organise their tasks where reminders will be like blatantly in their face. I think that would be very helpful. And just, I guess, being really motivating and just making the patient remind themselves of what they've got going for themselves, and like I guess congratulating them for the little things, because the little things are a lot. And I think when you have that reward system going in place, it can be like really positive, and I guess it holds yourself accountable as well.
Okay, and we've kind of explored a lot of the clinical side from a research perspective, because we want to focus on both sides. What do you think is kind of lacking within the research community around ADHD and eating disorders?
I think in terms of what I've realised doesn't have a lot of like cover in the area is the sleep side of things, because I know that it can be interlinked with my eating disorder as a whole. But definitely maybe just, I think I'd find it very helpful if there was just a bit more into like the sleep side and like the procrastinating sleep, and just a bit more help out there.
Well, thank you for coming in and speaking with us today. It was really great to kind of hear your side of it and hear both kind of what you would like to see from a research side, but also hearing about the clinical side and how beneficial it's been working with your therapist, but also the group program. Anything you want to add, Lauren?
No, that was really helpful. That I feel like we covered everything. So thank you so much for your time.
Thank you for having me.
You're very welcome.
Okay, we'll end it there. All right, so everyone, thanks for listening in today. I guess in terms of some takeaways, my biggest takeaway was how transformative it can be, having a therapist that kind of sees you beyond the diagnosis that you're there to work on. For this patient that's come in today, this lived experience, it sounds like being able to acknowledge the ADHD side is what's actually kind of driven them towards recovery.
Yeah, I totally agree. And I think that's why it's so important that clinicians and also individuals more broadly are aware of what ADHD might look like and how it might influence an eating disorder or someone's ability to engage in treatment, or how they maybe show up for themselves. So I thought that was really useful and insightful, and hopefully everyone else feels the same.
All right, so this has been our second episode of Co-Produced. Thanks for listening.
And goodbye.